Anak-anak milenial, bangun! Gosok gigi.
Clean up all your mess and taking caffeine. It's your soul pulling on you. Everyone's stories, they're not the same. Let go of it like you.
Hey! Betul ke kau menggosok gigi rupa itu? Ish! Guys.
Assalamualaikum and hi everyone that are here today.
Oh, ya,
Assalamualaikum, madam.
Ya, waalaikumsalam.
Assalamualaikum, Dr. Madihah. How are you?
Salam. Good.
Is everyone else doing great too?
Yeah.
So, Doctor, I have an interesting news. We have participants not only from Malaysia but also from Mexico. Hola, Marcos.
Oh,
Hola,
nice.
Marcos.
You should have invited the whole of Mexico to join. Gracias.
Gracias.
Okay, so welcome everyone to PD Talk Series 2.0.
Hello, everyone.
So I'm feeling great and I'm very happy to have each and every one of you here together with us for this PD Talk Series 2.0. But let me introduce myself. My name is Mayang Zahirah Ibrahim. So I'll be the host for today. And together with me is...
I am Alina Ali, moderator for today.
Hi everyone, I am Cady Norraman and I am in charge for technical.
Hi, Assalamualaikum. My name is Nur Fatin Nabiela. You can call me Bella and I'm in multimedia for today.
Hi everyone, so my name is Nur Farashikin and you can call me Ikin. So I'm in charge for multimedia for today.
Okay, thank you girls.
Okay. First and foremost, I would like to thank each and everyone who are here with us today for considering a time to join this talk, oral health and self-esteem, the quality of life indicator. We are going to discuss about oral care, which will impact our self-esteem. And our guest speaker will elaborate and share on her insight regarding this topic. So we hope throughout this session, you will get fruitful information and facts in regard of oral care and also self-esteem. And also, we really hope that all participants here can stay with us until the end because we have exciting activity at the end later. So everyone, please stay tuned, yeah? Without further ado, Mayang, you may continue to brief on the slides that we are going to discuss.
Thank you, Alina. So apparently, we'll have 3 slots for today. Firstly, will be issues in oral health, followed by oral health and self-esteem, and lastly will be dental care 101. So throughout this session, we actually have prepared question for Dr. Madihah beforehand. So we hope everyone can stay with us till the end of the session, so that we all can get a point and opinion on this topic. And if you have questions later on, you may ask Dr. Madihah directly for the in the Q&A session later. But perhaps before we start with the talk, it would be honored for us to share the background of our wonderful guest speaker, Dr. Madihah Ismail. Dr. Madihah Ismail obtained her dental surgery degree from Rajiv Gandhi University of Health Science, India, and graduated with first class degree. Getting trained in public hospitals, she has vast experience with dealing with a lot of patients with various conditions. Before pursuing her study in dentistry during her school days, she was an excellent, dedicated, and committed student at SMK Aminuddin Baki. She graduated with straight A's for her Sijil Pelajaran Malaysia before obtaining her A-level also with straight A's from College Teknologi Timur, Sepang. Dr. Madihah has actively participated in many conventions and currently, she is participating in an ongoing research on perception of patients to endodontic treatment. Always keen in the power of empathy and humbleness, Dr. Madihah believes that being kind and gentle to patients goes a long way. So now, before we go to our first slot, Doctor, if you don't mind, maybe you can share with us the experience during your study and while being the dentist now.
During study, so basically because I studied in India, kan. And also bila I dekat India tu, it wasn't a big city. It was a very kampung, very rural. Like even the Indians never heard of this place because it's actually very like ceruk. So people there don't really have awareness. So and they have this habit of little chewing, makan serious gitu. So their mouth is almost always red. So basically when you do a checkup.
Wow, right.
Yeah. Like, you know sirih, I'm not sure if you guys tahu how it looks like when orang makan sirih.
Yeah.
So like very merah. And then they like to spit around. So like their spit will be like merah everywhere like that. So the oral hygiene is very bad lah. So like when I come here, and thankfully for me, I'm based in KL. So people in the city, I think they have more awareness. So the oral hygiene comparatively to the kampung in India that I was in, much better here lah.
Oh, wow. So Doctor, so you're being so thankful to be back in the home country, right?
Yes, I am.
Okay, so now we are going to our first slot, which is issues in oral health. But everyone, I will let Alina ask the first questions because I'm too nervous right now, so I need to take a break.
Okay, thank you so much, Mayang.
Welcome.
Okay, so I'm going to start with our first question for today. Okay, according to World Health Organization, WHO, it is stated that oral health is a key indicator of our well-being, our overall health, and also our quality of life. Yeah, because we always can see that when we have a dental disease, it can affect the way a person looks and also sounds. And this is where it will lead to poor and also low self-esteem. And also, among adults in Malaysia, it is reported that about 7% of them had lost all their natural teeth. So, Doctor, what is your take on these kids?
Okay, thank you for the question. So, you were saying above the age of 60 kan? Okay, so basically in Malaysia it's quite what we call is periodontal status lah. Periodontal ni is actually our gum. It's just a dental term. So basically gum problem. So actually I'm not surprised because when I started working in the government sector, we have to start going to school. We go to primary schools and high school, and I was so surprised to see that the oral status, oral hygiene of kids as young as 16 years old, 17 years old have a very bad gum problem. So basically, when you don't brush your teeth properly, this plug that gigi to it hardens and become karang gigi. Sometimes you feel like there's a stony, hard consistency of the belakang gigi. You can call it karang gigi lah. So when you have that over a long period of time, it causes your gum to weaken and gigi akan start longgar. And bila gigi longgar sikit, it can still be fixed, like you can do scaling and all that. But when it has been mobile to a certain extent yang very longgar, then memang cannot save and have to cabut lah. Imagine having that problem at such a young age, at the age of 17, 18, and after high school, you don't really have to see a dentist unless you yang pergi jumpa. So these kind of people, they lack awareness, so diorang tak kisah sangat pasal gigi. So when you are having this problem daripada high school and you don't see a dentist anymore, so by the age of 40 or 45 pun you can start losing teeth already.
So it is the matter of awareness.
Yeah, so basically I would say that it's lack of awareness lah. And of course there's also a reason of gigi lubang untuk kena cabut. That is also because of awareness lah. Basically kalau tak ada kesedaran dentist. Then like I said lah, like in high school, the dentist will come every year to check your teeth. So, okay, we will still take care of your teeth. But after high school, you're on your own. So if you lack awareness and you don't go for a regular dental checkup, you really wouldn't realize that you have all these problems.
So it is really important to start from the young age, right, Doctor?
Yes.
Okay. Talking about loss of teeth, kan? Suddenly I remember wisdom teeth, atau kita panggil dia sebagai gigi gigi geraham, kan?
Yeah.
We usually heard that wisdom tooth ni selalu cabut kan, nak remove dia kan. So my question, why is this wisdom teeth ni need to be removed bila dia keluar tu? Sebab bila dah cabut dah tak jadi wisdom dah tak wise lah, so dia orang dah tak pandai ke macam mana?
Okay, faham. Okay, so like macam this question, I think is very relatable to you guys lah. Sebab wisdom teeth will usually come out around this age, macam 18 to 21 macam tu, it will start coming out. Okay, so wisdom tooth ni, okay, so in a normal person lah, we usually have 2 to 3 molars. Molars ni is gigi geraham yang besar tu, the one that we used to chew at the back of our mouth. So most people have 2 or 3 during this day lah. So the third one is what we call the wisdom tooth. Like macam for me myself, I don't have wisdom teeth. Like I memang naturally tak ada, so I think I'm lucky. Okay, so this third molar is actually the last tooth to tumbuh dalam mulut. And okay, I'm not sure if this is gonna be boring. It's historically lah, macam back in the days, zaman-zaman our ancestors, like they even have up to 4 molars. They probably macam there isn't any research saying that anything in specific causes this lah, but we do feel that environmental factor, diet factor affect the number of teeth that we have in our mouth. So wisdom tooth ni, as time goes by, macam back in the days, people eat harder food. Maybe when they cook meat, it's not as soft as the one that kita makan sekarang. Daging kita makan sekarang, like you can, like rebus lama-lama, or I don't know what you can put in the daging to make it soft. So basically our diet nowadays is much more softer compared to the ones that we had, the one that our ancestors had lah. So we don't need that many to chew our food. So some dentists even call it an evolution of human dentition, where we don't need it anymore. It becomes obsolete. So just our body stop producing it. Yeah. So and then also about yang nak kena cabut tu, not all cases kena cabut. So basically it's the last tooth to come out in the mouth. So sometimes mulut kita dah tak ada ruang, that there's no space for it to come out. So either it will get stuck in the gum forever, it doesn't disturb you tak kacau dia, so like leave it there. Or in most cases it will erupt either towards the cheek or towards the front, towards the back. So it will usually, it's the case for most people lah, and then it will cause some cheek biting, or also when it's too far at the back, you cannot clean it properly, so it becomes infected. So that is when we advise for cabut. And also, even if it is like malaligned, dia tumbuh sengit ke apa ke, if it doesn't cause you any pain, if it doesn't cause any discomfort, then we advise to just leave it there. Unless it causes a problem, then you take it out.
Yeah. So, doctor, do you have the wisdom tooth?
No, I'm the evolutionized species where I don't have my.
Same with me. I also do not have the wisdom tooth. I've already X-ray twice. I also don't have.
You memang tak ada.
Yeah.
Pretty lucky I must say, because it causes a lot of problems.
See, for those that don't have the wisdom tooth doesn't mean you are not wise. See, Dr. Madihah, she's a dentist, and Alina. Okay, so now doktor tu macam kalau ada wisdom tooth and then dia infected ke, atau like being annoying disturbance, so we have to get it removed kan. And then tapi benda tu is gonna be so hurt lah kan, because during macam waktu I'm getting the braces treatment, I have to get 4 of my teeth removed. I know it's hurt a lot. Macam after 2 days pun still sakit lagi. And then maybe because of sakit macam tu and all apa semua, some people they are scared seeing the dentist. Like my cousin brother, doctor, I'm not sure if he is in here now. He is scared of seeing dentist tau. Macam very very scared tu, macam sangat teruk sampai kalau allergic to the word dentist lah. Sebab when he was 15, while getting the treatment, the dentist suddenly accidentally poked his cheek, and then he got so scared, and then he really hate the word dentist. After that, it's been 10 years since, and he's now 25 pun, dia memang still tak nak lah dengar, tak nak lah aku macam tu. So doctor, how do you like advise my cousin brother? I think he's in here tau. And then selalu ni kan, can you share with us how do dentists usually handle those like my cousin brother?
Anyway, if Mayang's cousin brother is here, hi. So I think a lot of people have the same experience about, I don't know, like seriously, so many people are scared of dentists. I don't know why, to be honest. Okay, sebab
that's why dentists need to be pretty like you.
Thanks, madam. So anyway, so yeah, we do get that a lot, and usually basically macam kalau kita consult a patient and then we tell them a certain procedure, the first question that they're gonna ask is it painful? Sakit tak, doctor? So that is really the first question that everyone is gonna ask. So what we would say is so I can tell like everyone's fear is actually the pain. But what I can say is that you should just come for a dental checkup when you are not having any problems. Like like now, semua orang macam okay, tak ada orang yang sakit gigi kan, and so you just should come to for a checkup lah. So and then us doctors will evaluate your oral hygiene, your oral health, if you need any treatment. And usually bila you datang when there is no pain, that you wouldn't usually need any treatment that will be painful. Like, you know, usually when you come on a normal day, all you probably need is a scaling, because currently sikit that would be painful. Sometimes for people yang ada bad sensitivity, they might find it dulu, but for that you can give like the some views like it's too bad for them. Or also if you come on a normal day and you tak sakit, even if you ada lubang, you ada caries cavity, it would be a small one where it wouldn't be painful to tampal lah. But then most people, they would only come to a dentist when they are already in pain. Like, you know, dah bengkak dan sakit gila, then they come to us, and then when you are in that much of pain, you are anxious and you are nervous semua kan. So I baru je nak selak mulut sikit with the mouth mirror that is not even sharp. Like baru terkena sikit, they started jumping. You know? So like that is what happens when you are too scared and already in pain. So what I would suggest is just come for a dental checkup on a normal day where you're not feeling any pain. So when you come, we will explain to you what are the procedures, what are the treatments needed. And then you will, like, you have your own time, you can go home and think if you actually want to go through with it. We're not going to force you to do it on your first visit. Yeah. So, and I think it's very important that we dentists explain the treatment properly to the patient so they know what to expect. And you cannot lie to patient yang okay tak sakit langsung. You know, like cabut gigi nak bagi bius. You know, like the injection will hurt a bit, like when you get a normal injection, but the bius will numb a bit. You know, like you have to explain to the patient so they know what to expect lah. And also like I think it's our responsibility also because there was a patient yang I dapat, she was 40 something, but her oral hygiene is very bad and karang gigi semua teruk. Because she told me that the time that she came on that day, because memang sakit gila, she dah tak tahan, that's why she came. Because she was so traumatized that when she was in standard 2 in school, a pregnant dentist was so garang and she gets so scared of dentists. So basically after the time that she was in school sampai sekarang, and she was saying that macam, if all dentists are actually nice, she would have come to see us even sooner. So I think it's also our responsibility to check and your responsibility to come to us when you guys are not really having any problems.
Due to the traumatic experience lah, kan doktor?
Yeah.
I think my cousin brother have to just go and see the dentist.
Yeah, just come for a checkup because the checkup is memang tak akan painful lah. So just come for a checkup and we will evaluate lah.
That is dentist promise, right? The dental checkup doesn't hurt, right?
Yeah, the dental checkup memang doesn't hurt at all.
So everyone just go for the dental checkup, okay? The dental checkup doesn't hurt. That's what the dentist promised you, okay?
During my time,
Okay.
But
I'm going to do
madam,
yeah.
your time is like our time too, kan?
Oh yeah. During our time, the dentist kan, they don't really explain to you the procedure. They're like, buka mulut.
I think
my God.
Yeah, sebab especially kalau macam dekat school kan, macam maybe we only have 1 hour, but we have to check like 40 patients. So we don't really have the time to actually explain. Yeah, that is sometimes the problem in the government setting lah. Like we don't have the leisure of time to explain to patient, because you know, like sometimes when I work from 8 to 1 in the morning dealing with the outpatient, in that 5 hours we have to do like 40 or 30 cases. So for each patient you can only allocate like 10 or 15 minutes. So you don't have the time to actually really explain the whole thing lah. But most of the time I try my best to do that as much as I can.
I'm scared. I'm still scared of dentists. I'm scared of 2 people in this world. Dentist and
who are they?
My mom and dentist.
In case lah, madam.
Come to my clinic and let me do a check-up for you.
I am scared of dentist and also my dad. So the dental checkup doesn't hurt, and then kita kena pergi je because to get like good oral care kan. tapi kan doktor, based on my research lah, oral care ni dia doesn't limited to only having good looking teeth, straight and white teeth. It's actually more than that because it relates to oral odor. Oral odor ni macam isu sensitif sikit lah doktor kan. And then lagi-lagi during Ramadan, we as a Muslim, we fasting during the day kan. So I feel like I'm not confident to talk to people because I think like I exhale unpleasant smell. That is before pandemic. Like right now, everyone have to wear mask. So I think every one of us embrace our own mouth smell. Kan? Semua orang dah tahu bau mulut masing-masing sebab semua orang pakai mask. So doktor, macam I thought it was just me. And then when I share this concern with my friends, they also have the same concern. So doktor kan, how do we overcome the oral odor? Ataupun at least kita nak kurangkan dia. And my additional question is, kalau we want to advise like macam mana kita nak cakap kat our friend like she has this problem.
So basically during fasting or during any time where we are not eating for a long time, where our mouth is just dry, dia memang akan ada tendency to have a weird smell. It is because that bila kita tak makan or we don't drink or eat, our mouth becomes dry, and our saliva, ileum kita, it helps in cleaning our mouth like all the time because our ileum memang sentiasa diproduce and it will keep on cleaning our mouth. We will either swallow it ke apa macam tu kan. So when you are not eating, you're not drinking and saliva is not produced, so the dead cells and the bacteria in your mouth becomes accumulated there. It's not swallowed or it's not spitted out. So that is the thing that causes this weird breath when you fast lah. And also kalau you perasan juga, even in the morning after you wake up pun you akan ada this morning breath. It's because like the whole night 8 jam you tidur tu you haven't drank or eaten anything, so that's why you memang akan ada bau mulut sikit lah. But that is just because it's dry and there is that bacteria in your mouth that is not taken out. So to get rid of that, you just have to keep hydrated lah, minum air. Or maybe kalau during puasa you cannot drink water, you just have to gargle, keep your mouth moist to keep it from having bad odor. And there are also certain foods that you can avoid to avoid having bad breath lah. So you might think it's a myth that garlic and onions causes bad breath, tapi sebenarnya it's actually a fact. Okay, so because onion and garlic ada sulfur compound, and the sulfur compound when you eat, it will linger in your mouth, and when you speak, it will be exhaled sekali dengan nafas lah. So people memang akan bau lah you punya bawang lepas makan. So those are the things that you need to avoid if you tak nak ada bad breath. And also if you want some tips, what I would say is brush your teeth at night before you sleep. So basically lepas you dah makan tu, you makan dinner, you go straight away to sleep. Like don't eat anything else, because if you eat something before you sleep, you have 8 hours of tak buat apa-apa semua kan. So the bacteria will be having a party in your mouth the whole night walaupun you sound asleep. Okay,
having party in the mouth.
Yeah. So as for the morning, have brush your teeth after having breakfast, because once you dah makan breakfast, there will be sugar and everything in your mouth. So you have to brush your teeth to keep it clean from the time you had breakfast in the morning until lunch lah. If you bangun terus gigi and then you eat breakfast, your mouth will be full of sugar and everything from morning until the next time you brush your teeth, which is probably at night. So that is not good for the oral hygiene, and also can lead to bad odor lah. And as for the question yang pasal kawan tu kan, so if I mean we are all adults sekarang, macam we are all in our 20s, so macam semua dah besar lah basically. So when your friend has a bad breath, I think the best way to deal with it is to talk to her personally, but make sure personally lah, seorang-seorang. You don't go and like maybe satu gang datang bombat dia cakap duduk kau busuk tu pandai-pandai begini. You don't do that. Memang akan gaduh lah. So you go and talk to her nicely, just tell her that I feel like you are having your mouth smells funny and maybe you should start taking care of your oral health, and tell them that you're not doing this just for yourself ke apa. You are telling her because it's for
For
her
her own good.
Yeah, for her own good. Macam mulut ibu saya pernah kawan kan you. So yeah, I think it's nice at this age when your friend actually genuinely tells you something because they care about you, like not because of anything else. So I think people will actually appreciate that. But of course it depends on how you say it.
So nak tegur kawan-kawan tu kena berbudi bahasa. So doktor, saya baru tahu tip gosok gigi lepas kita have a breakfast kan. Cakap pasal dry mouth tadi tu, kan sebab malam-malam kita dah gosok gigi, kita dah tidur, lepas tu kita bangun tu terus nak minum air. Ada dietitian yang cakap it is good for our organ if we as soon as we woke up tu we terus minum air kosong kan. Itu minum air, kita tak tertelan sekali ke bakteria-bakteria yang ada dalam mulut tu?
Faham. I get the question. So sebenarnya it's not an issue pun because the whole time we have bacteria and saliva in our mouth. Okay, so basically in the morning, there's no issue as long as you brush your teeth before you sleep. Because basically in our mouth there is no bad bacteria. They're like actually dia memang penghuni dalam mulut kita. Basically they say that they're not bad bacteria. Only when you have problems like cavities or you have some gum problems, there will be like some specific bacteria yang akan rosakkan gigi lah. So it's really not an issue when you want to wake up in the morning and drink water. Like all these bacteria, like it wouldn't cause harm to you lah basically. But then I understand that in the morning when you wake up, sometimes maybe you feel disgusted or disturbed by the fact that your mouth berbau macam tu and then you just want to drink straight away. So maybe you can just gargle first and then drink. But there is no issue of swallowing bacteria.
I see. Okay. Cakap pasal oral order ni kan doktor. I have phlegm, our kahak ni. Ada orang cakap kahak ni punca bau mulut kita tu. Sebab phlegm ni kan dia ada yang berwarna tu kan. It's contain bacteria juga kan. So is it really true doctor that phlegm is a factor of this problem? And also, is it normal and okay for us to rub our tongue every time we brush our teeth because we tend to get rid of the phlegm when we brush our teeth too?
So your question is, does phlegm causes bad breath juga? Like that is the question kan? I understand about brushing your teeth and your tongue sebab memang macam sometimes some food that we eat, especially when you eat dairy product like milk and cheese, sometimes they get stuck on your tongue, so that can cause bad breath. So yes, you need to brush your tongue as well as your teeth. But when it comes to phlegm, actually it doesn't have anything to do with the mouth. Sebab phlegm is more of, I think if you have phlegm that much in the morning, your main concern is your respiratory system and not your dental. So yes, having phlegm in the morning too, you wouldn't want to see a dentist. I think you might want to see a medical doctor.
So doctor,
yeah,
you know sometimes we have people around us or maybe tersendiri when we mandi kita kan you hear them like in the morning like you can hear like they make that sound in the morning, like my neighbor, like ke atas dengar okay he's up, he's going to work, so it's like he's telling the whole neighborhood, yes, I'm up, I'm cleaning my teeth. So they do that like sounds really disgusting, but is this healthy? Should we be doing the same or what?
Like I say, I feel like
does this have any concern with with your oral? Because it seems whenever kita keluarkan kita punya phlegm tu, like myself, if I keluarkan my phlegm, I smell you know how we in the morning kita bau like that.
Yeah, the morning breath.
After we clear out everything kita punya kahak, we smell better. So it seems like
well, based on my knowledge, memang kahak ni it has nothing to do with the mouth organ. And unless you like macam okay, basically you jolok sikit to force the kahak to come out kan. It doesn't really have any effect on the oral cavity unless you jolok tu until you vomit. Like if you vomit is acidic, so it will corrode your teeth on the inside part. So that is when it becomes a dental concern. If it's just the kahak, actually it has nothing to do with the oral cavity.
Well, I mean, I have sinus. Jadi if I don't take care of my ENT, so if I don't clear my throat and everything in the morning, it seems like I'm gonna have like I wouldn't say it's unpleasant lah kan, the smell that comes out. But every morning, I will clean everything.
There is a connection between the nose, like the nasal cavity, we call that like ruang dalam hidung and our mouth. But when so having sinusitis actually can cause mouth odor. But like I said, that is not a dental concern because that is related to your nose. But it does. There are actually quite a few medical conditions that can have an effect on how the mouth smells. Even diabetes, even liver problem. Like liver problem, you would think that it is so far in the body. Like why would it have any effect on our mouth, on our breath? So actually, when some diseases, the metabolic product can be excreted through our breath. So that's why some diseases, some medical conditions actually can lead to bad breath. Also, sinusitis is one of them. Like it's a problem with the sinus, but it can cause bad mouth smell. Yeah.
Doctor, I have like a friend kan, doctor kan, like she's addicted to brushing her teeth. Like me tadi, I just knew that we have to like take breakfast first, and then after that baru kita brush our teeth. But then my friend kan, doctor, every time after meal she'll brush her teeth. Maybe because we are in our 20s, so she's scared like if we see we go out and then see someone suddenly bump into her crush ke, and then she feel like being insecure kot sebab nanti tiba-tiba got spinach on her teeth kan. So but then I also heard that we cannot brush our teeth at least 30 minutes after a meal. Is this true or no, doctor?
Okay. So you rasa is it a myth or a fact?
Because like I think like I have read that in Twitter from a dentist also, so I believe. But I'm not sure the scientific reason behind that.
Yeah, I really like the question. I feel like you guys really did a research on this. So actually, it is a fact. It is a fact. So
it's a fact.
Yeah, it's a fact. So it is true. So it is actually a bad behavior to brush your teeth immediately after eating lah. Because bila kita makan, when we eat, the bacteria in our mouth will help to break down the food. And when the food is broken down, there will be an acidic byproduct. So the pH in our mouth immediately after we eat will be lower lah, will be acidic. So in an acidic environment, the teeth will, gigi kita memang keras. Our teeth will somehow become relatively softer compared to its original strength. So bila you immediately brush after you makan with this acidic environment, bila you brush, it will be worn away. Dia akan terhakis.
So actually our teeth can be in soft condition juga.
Like it wouldn't be, I wouldn't say soft because you wouldn't like rasa macam dia soft macam lembut sangat. But comparatively, the actual kekerasan and the kekerasan after you makan, which is in an acidic environment, it will be somewhat softer. So when you brush immediately during that time, dia akan wear away, dia akan terhakis lah. So it's our saliva punya responsibility, I can say, to neutralize this acidity. So it takes about half an hour usually after meal untuk saliva kita betul-betul neutralize the pH. So during this half an hour, it is advisable not to brush your teeth lah. So wait until half an hour at least baru brush. And it is worse when you eat makanan masam lah, asam-asam, citrus fruit, orange ke apa ke, it's even worse because it's even more acidic. So if you rimas takut makanan terselit ke apa ke, after you makan, then you should just gargle and macam if you really want to brush your teeth, you wait after half an hour and start brushing.
So cerita K-drama tu salah lah.
Drama apa
K-drama tu dia selalu macam lepas dia makan dia gosok gigi.
Maybe dia dah tunggu 30 minutes. Maybe dia dah tunggu 30 minutes after tu kot, madam.
Tak adalah, mana ada. Dia pergi dating dengan boyfriend dia masuk bilik air. Lepas tu dia jumpa boyfriend dia punya perempuan lain, dia gosok gigi sebelah macam tu.
Basically what can happen if you brush your teeth terus is very ugly, and also dia akan cause sensitivity lah because your teeth become paste. So it will be more sensitive. So that's why mungkin in the long run, makan ice cream, dulu you boleh makan ice cream, suddenly like dah sikit you dah tak boleh makan because gigi sensitive because dah hakis semua tu lah.
See, so tak boleh lah sebenarnya gosok gigi right after a meal because like in long run nanti we cannot eat ice cream. See?
Selalu kalau lepas kita makan kan, kita makan, kita instead of brush our teeth, kita pakai toothpick kan, tolak-tolak. And of course ada hadis yang mengatakan kita tak boleh makan, tak boleh telan benda yang kita cucuk tu kan, selalu kita telan terus kan, betul tak? So is this in terms of medical terms, is this wrong ataupun memang kita kena buang? Kalau ikut hadis dia kata memang tak boleh.
To be honest, I'm not really sure about this lah, madam. So if you want to know about it, I have to get back to you after this because
kan dia kata kalau kita
what you mean is like kita korek makanan pakai toothpick and then whether that food we can eat or we should buang.
Kan selalu kita buat macam ni kan. Takkan kita nak keluar tui macam tu kan. Jadi kita telan je lah, telan. So apparently they say not good because itu ada bakteria, jadi kita buang. But then based on this today punya session so far, some bacteria can be good, betul tak? So,
but like I said, if the concern is bacteria, then actually it's not really a big concern lah, because like I said, those things that we call bacteria memang is actually in our mouth, like they live in our mouth and they are actually not bad bacteria. They have a function there, like I said, to break down food and all that. So I don't like this is not a medical thing, like I'm not sure exactly, but based on what I know, based on my knowledge, I don't think there is a problem with eating the food yang you dah from the jilat-jilat gigi tu, because anyway it's in your mouth.
Okay.
Alright. But if you really want to know, I'll find out about it and maybe I'll find you out.
Thank you. Because I read some hadith, they say, I'm not sure if it's tak digalakkan. I'm sure it's not haram, but I think it's not advisable lah.
We have like from Dr. Nana, I say it's not advisable to use toothpick. It's better to floss instead.
Yes. Thanks, Dr. Masliana.
Okay, Dr. Nana. Thank you. So we want to back to the basic. Kan sebenarnya, like even I'm not sure right now if I'm practicing the correct way to brush my teeth. So sebenarnya doktor, what is the correct way to brush our teeth?
Okay, so actually kalau kita even belajar dalam textbook pun ada banyak sebenarnya. There are actually more than one way of brushing teeth. So usually when a patient comes to our clinic and look, dia dah saying like oral hygiene is good, then we wouldn't recommend any other type of technique of toothbrushing lah, because basically what matters is that it works for you. As long as it cleans your mouth properly, then it's okay. But let's say if someone comes to the bad oral hygiene, then the technique that we advise nama dia is modified pass technique lah, which is obviously not familiar to you guys kan. So basically this technique, most importantly, use a soft bristle brush. Don't use medium, don't use hard. But I know that some people suka guna medium or hard because they see it feels cleaner, but it's not good for your teeth nor for your gum. So use a soft bristle. And then make sure you orient the toothbrush in the bristle, so like 45 degrees towards your teeth. So and when you use a soft bristle brush, then you can actually feel the bristles go between your gums. You can actually feel it going between your gums and the tooth. So make sure it's 45 degrees towards the gum. And then you buat lah depan belakang macam tu. And then take it down. So for upper teeth, you take it down lah. For lower teeth, you
take upwards.
So do that way for the whole thing lah. So you can actually, like I said, if you use a soft bristle brush, you can really feel the bristles go through between your teeth and also between the gum and the teeth. So 45 degrees towards the gum, depan belakang a few times, and then take it down. So the same thing for the whole mouth lah.
I think the 45 degrees also applies to those who wear braces, because like my dentist always remind me to do the 45 degree between the bracket and also the teeth.
Yes, and also like
double.
So for people wearing braces, we usually advise for interdental brush. Interdental brush, uni-tufted brush. It's like just a small brush tu. Is that instead of the whole toothbrush kan kita ada banyak bristles, it's just like one tuft of it. So you macam lagi senang to clean between the
bracket, right?
Floss, because betul-betul celah-celah gigi tu cannot really bersih kan, so you have to use floss lah to clean gigi to really have a proper good oral hygiene.
Is it true like kalau we wear braces, so we have to go for scaling more frequent than those that do not wear braces?
Like I said, you have to come for a checkup kan, like macam when you wear braces, you have a regular checkup kan. So during the whole time, your orthodontist should evaluate your oral hygiene lah, because when you wear braces, obviously it's harder to keep your mouth clean because there's like something stuck to your teeth. So to really keep it clean is quite ridiculous. And I know a friend yang macam in the morning I brush my teeth for 2 minutes and she has to brush her teeth for 10 minutes. So she really has to go through each of the brackets. So it really takes time. So if you don't have that much patience to really take care of for the hygiene of your braces, then you have to go for scaling quite often lah, kalau tak affect your gums. Yeah.
I'm not patient. Thank you, Doctor.
Doktor sebut pasal duration of our brushing our teeth tadi tu. Sebab saya selalu dengar kalau kita brush gigi tak boleh lebih daripada 3 minit. Betul ke doktor?
Do anyone actually brush their teeth more than 2 minutes? I brush my teeth minit setengah, 2 minit pun I feel like it's long enough already.
Seriously?
It doesn't need to be that long. Yeah. But it depends because in some patients yang memang really want to take care of their oral hygiene, sometimes we ask them to use kids toothbrush. Kids toothbrush
yes.
Right? So they really have to brush their teeth one by one. You can really feel the brush cleaning your teeth, like so you spend more time on one tooth compared to the big brush. So so the time can actually differ. As long as you don't use too much force to brush and you don't brush it in the wrong way, then it shouldn't be any problem. The duration doesn't really matter, I think. Yeah.
And also because the toothbrush, the kids toothbrush tu cuter. Macam ada princess lah, Barbie lah.
Kan, yeah.
I like those
things. Lama-lama sikit nak brush teeth kan.
So, guys, we need to know and practice the right way to brush our teeth because if we didn't do so, nanti macam-macam yang kita kena buat in the future kan. So, kena jumpa dentist selalu. Kata semua takut dentist. Nanti tak nak jaga gigi. Macam mana?
Kan, kesian dentist. Kenapa korang nak takut dengan I?
Tak tahu, the feeling tu anxious.
Yeah.
Alina, macam mana gigi you putih sangat? You pakai apa?
This is because of ni sebab lighting semua kot, tapi gigi saya tak putih.
So you pakai whitening malam tadi?
Madam.
Semata-mata untuk talk ni.
Okay, Dr. Madihah, nak dengar your personal opinion sikit about this gargle solution. And Listerine, and then we have like a Colgate thing, So some are very strong, right? Some are very strong. Like you feel like, oh my god, your mouth is going to explode.
Burns,
Yeah, feel like burning. So is this good, like for a long term? And if we want to choose a good gargle solution, what is your recommendation? And if you don't mind sharing us your secret, I'm sure as a dentist you use the best. So, I don't mean for you to market any product. I'm sure but sometimes dentists have their own preference. So maybe you could share with us.
Actually, I actually asked people who are more experienced in this, and I'm not sure if I can mention any brands lah. So I will not mention any brands. So I takut you will macam menyentuh sensitivity or whatever.
Right.
So basically for mouthwash, sometimes yang aku rasa very burning tu is because they have a high alcohol content. So basically the idea of having alcohol in mouthwash is to kill the bacteria and all that. But from my personal opinion and also from what I read, those mouthwash yang ada high alcohol content is actually not very good for your mouth because alcohol dehydrates. It will cause your mouth to become dry. So, and also the ones with very high alcohol content, when you gargle with those, you really feel burning in your mouth. So usually when patients ask us about mouthwash, we would advise for those yang without alcohol lah, the ones yang. So basically when you buy a mouthwash, you try and look for the ones with no alcohol because it will cause less burning and also it wouldn't really cause dehydration lah. So basically because mouthwash with alcohol causes dry mouth.
But then I tried both, one without alcohol, one with. So the thing is, the satisfaction is definitely more the one.
Yes, I think because the one without alcohol, you don't really feel like your mouth is clean. You don't really feel the freshness, kan? So So actually, when we dentists also we discuss about this, like why would they put so much alcohol in that? Like because it doesn't really have many added effects besides, and it has a bad side effect as well, the drying of the mouth. But what we think is that these manufacturers they want the consumers to feel that freshness. So maybe it is more of like you enjoy using it rather than its actual function, something like that. Yeah. So it's actually for your mouth it's better to go for the one with more alcohol.
Okay. Thank you.
This is the last question from me, and after this we will proceed with the Q&A session, which will be more interesting because I'm sure there are dah tak sabar nak tanya soalan dekat doktor.
Ramai nak tanya ni, semua ada masalah tersendiri.
Sebab dekat chat box yang ada soalan-soalan dekat chat box nanti boleh tanya sendiri dengan doktor, kalau boleh kita minta on camera mic. Okay nanti?
Okay.
Soalan ni, the last question from me is, saya nak tahu, sebab kita generally most of us think yang private medical center ni selalu lagi more equipped compared to public hospital kan, which diorang punya treatments tu, sebab diorang punya treatments tu lagi limited dekat public kan. Tapi macam mana case yang for those who cannot afford treatment like macam braces ke, cosmetic dentistry treatment ke, root canal treatment ke?
So basically because I am in the government setting kan, so what I must say is that I disagree if you were to say that the government facilities are not as well equipped as the private facilities. They are actually quite well equipped. But the problem is that we treat more of the cases that that the need treatment instead of the want treatment. Like macam I need to get my teeth fixed because of some problems rather than macam I want to just look prettier with better teeth. So like macam in the government setting, let's say for braces kan, they actually offer braces only service up until the age of 17. Like until the age of 17, even if it's not a very bad malalignment of the teeth, kita still accept. Like basically you have to come to the primary clinic first. The doctors in the primary clinic akan refer you to the specialist for braces. But after the age of 17, if you just want to wear braces because gigi depan ni sangat sikit, you start cantik, you want to wear braces, we don't accept those cases. Unless if you memang you are above the age of 17 and the malalignment of teeth causes you to not be able to eat properly, cannot speak properly, or you have some breathing problem because gigi teruk sangat. That actually happens in some people where the gigi teruk sangat, so the shape of the mouth makes it difficult for them to breathe or eat. In those cases, we do accept. So like the government clinic is like our price is much cheaper compared to when go to private kan. So of course, semua orang kalau boleh nak go for government. So we have a lot of patients coming. So if we were to treat each and every one of the cases, memang tak boleh. So that's why we have to do case selection and do it only for the people who really need it. And also like macam now what is famous is veneering kan. Veneering yang orang macam letak gigi kat depan tu kan, that is very
yang putih cantik tu.
Yes. So besides purely for aesthetic, ada juga sebab lain for you to do that. Like I'm not sure if you guys heard of fluorosis. Fluorosis is when your teeth ada white discoloration and it really cannot be treated anyways besides doing veneering. So let's say if you really have a bad fluorosis problem, then kita akan consider doing it for you. But if you just nak buat veneering, I rasa gigi I ni memang tak cantik, I want a white veneer to cover it, then you're not going to entertain your sorry. Okay, so but for cases like root canal treatment, we actually do also in the government clinic, because in the past before COVID lah, this is I'm going to say the differences before and after COVID. So before COVID, kalau you come for scaling, for filling, then you can come and do it. Kita panggil step. Step is like you come, we do, you go home. Like terus buat, tak payah appointment. But because of COVID, now we have like all these equipment, some aerosol terminator and some like complicated stuff in the room, which is to help with the disinfection and keeping the room clean lah. So now if you datang memang for check up, if you need filling or scaling, then we will have to put you in an appointment lah. So basically it's still the same as before COVID, all the treatments. Root canal treatment, we do offer root canal treatment, and if root canal treatment tu macam a bit more complicated and cannot be done in the primary level, we will refer you to specialists. So that is not really an issue lah. So I hope I answered your question, where in the government we cater more to those who need the treatment rather than just for aesthetic.
Who wants the treatment?
Yeah.
So now that the public dentist is accepting patients lah, basically, even for scaling.
Yeah, because actually during awal-awal hari tu kan, MCO started in March. Like in the beginning, we only cater for emergency cases. But a few months ago, I think it was in October or November, we started getting all the equipment needed to have a safe environment to do all this treatment lah during COVID. So start November hari tu, we started doing treatments already. But very limited lah, macam sehari we can only have like a few patients, because one patient we give a half an hour slot, and for every macam between patients kita kena keep the room for like half an hour to keep it disinfected and all that.
And
so,
we have to make appointment, is it, doctor?
Yes, basically for check-up macam for check-up you can walk in. Let's say you nak tampal gigi kan, you can walk in and then you can say that, oh, I nak tampal gigi, so you will get into the treatment room for a check-up, and then if you actually need a treatment, we will give you an appointment after that.
Okay, alright.
Oh, understood.
But for check-up, you don't need an appointment, you can walk in.
Okay.
Thank you so much for your answer, doctor. It's really sangat-sangat menjawab lah kepada soalan tadi tu.
Seems like ramai yang tak nak tanya soalan ni. Dah penuh dah chat box tu. Siapa yang
Frozen, you the one being chosen. Play the part like Moses, keep it fresh like roses.
Kita switch on camera and microphone.
So I call the first question. It's from Fatini Fakri. Where are you? If you're not here, then I just read the question. Doktor nak tanya, is it a myth gigi putih tu lagi sihat? So doktor?
Okay, so this is also a very heated argument now lah, sebab semua orang nak gigi putih kan. So basically
sampai melampau.
Yeah, everyone is so obsessed with having white teeth. I don't know why. It doesn't even look that good. So maybe it comes from a perspective.
Yeah, they wanna be K-pop star.
Kan, they want like an A4 white paper punya tooth color.
Yeah.
It's just okay. So basically, I'm gonna answer the question. Actually, the original color of our teeth memang yellow. Okay, so basically gigi kita ada two layers. Okay, the inner layer is what we call dentin. Dentin ni memang yellow. For everyone memang yellow. And then we have an outer covering called the enamel. Enamel is translucent. It's not transparent or opaque. It's translucent lah, so part of light can go through. So that's why you can see a yellow tint of the tooth of a natural tooth lah. So maybe you rasa, okay, some people have whiter teeth and some people have more yellow teeth. So probably it's because of the enamel. Usually if the enamel is thicker, then it appears whiter. And if the enamel is thinner, then it appears more yellow, because actually ada benda kuning kat dalam. So the thicker the outside covering, lagi sikit lah yellow tu nampak. Okay, so a healthy tooth memang akan ada that yellow tint. So that's why even now you see people using veneering semua. I think even for a normal person, even for a person who is not a dentist, there are some cases that I would advise is kalau macam say you memang avid coffee drinker or you're a smoker, so you are start the staining kan.
Yeah, coffee will do.
Apa tu?
Coffee will do the stain.
Coffee akan cause staining for after a long time kan. So kalau orang nak buat whitening because of that, I would advise, but with the condition that you stop the habit lah. Sebab kalau you buat whitening hari ni and you think it becomes white, esok you drink coffee then you start smoking, then there's no point, akan start yellow balik.
I see.
Yeah.
I cannot give up my coffee.
So
I love coffee too much.
Priority, madam, priority, white tea or coffee?
It's a forever love. It's an endless love with me and coffee. So you can
never ending love.
Never ending love.
So doctor, moving on to the next question. Can I call out your name? Like Saidatu Soleha. Oh, she's a MESCOM student ni from UiTM Shah Alam.
Hi.
Are you here? She's here.
Okay.
Doctor, what is your opinion if some of people like they just like use whitening products instead of they go and see the dentist for like for not whitening their teeth lah.
That's the question. Anything else? Okay. Okay. So it depends. There are many types of whitening agent. So there are actually some you can get from proper pharmacy, like banyak je over the counter punya whitening agent yang you boleh like there's like whitening strip and you can put for like 10 minutes macam tu. The effect might not be as much as kalau you get it professionally done lah. Macam even toothpaste, there are some whitening toothpaste, but maybe to a certain extent you can see the whitening effect, but it wouldn't be that and usually the ones yang you have to buy the proper one lah. Don't buy from Shopee made in China or other than that.
Okay, don't buy from Shopee.
I wouldn't say don't buy from there lah, but you don't buy those from macam made in China and proper apa ni, tak ada proper punya certification apa macam tu. Like buy from an authorized brand, buy from macam from a proper pharmacy macam tu. Then that shouldn't be a problem. But then again, even when you use over the counter punya sensitivity whitening products, you should stop when you feel like it causes too much sensitivity, because biasanya whitening product memang akan cause sensitivity.
So does that answer your question, Saidatu Soleha?
Yes. Thank you, doctor.
Okay.
Thank you, Saidatu. We have one more from AA to doctor. I'm your biggest fan. Who is AA? Is it Mr. or Miss? Are you here? Okay, I'll just read the question. From AA, Doctor, I'm your biggest fan. I wanna ask, if I brush my teeth and usually there's blood came out, wow, what should I do? Is it bad if I just ignore it?
It's actually a quite common problem. Because sometimes even when I was in school, I actually do get a bleeding gum problem. So basically, when you have bleeding gums, is because like I said just now, about brushing. There is a space between your tooth and your gum. So that's like for a normal person, the size would be like 2 mm, like we call it a pocket between your gigi and sila, like 2 mm. So in these 2 mm, sometimes when you eat and you don't brush your teeth properly, these areas get infested with bacteria that can cause gum problem. So bleeding gums is the first sign of, like one of the earliest sign of gum problem lah. But it's not in its advanced stage, it's in early stage. So when you start having bleeding gums during brushing, that's when you should realize that you need to go for scaling.
Oh, so it's an indicator that someone have to go for scaling when your gum bleed.
Yeah, it's an early sign of gum problem. So you have to go for scaling. Yeah.
Okay, understood that, Doctor.
Sorry, Doktor, saya ada soalan.
Yes. Okay.
Maybe you are cutting line.
Apa tu?
Sorry, saya ada soalan ni, saya dah terfikir lama dah. Saya nak tanya, adakah okey untuk kita terus gosok gigi selepas kita makan? What? Sebab
baru masuk lah ni.
Baru bangun.
Ni baru masuk lah ni.
Kantai dengan semua orang
Macam dah. Kenapa tak masuk kelas?
So I call Diana Nur Azhar.
Hi Doctor. I want to ask, recently saya punya gigi bawah, like macam rasa saya gigit makan, bukan keras tau, macam like saya gigit burger, something like that. Dia rasa macam gigi saya is pressing down. So saya tanyalah like my friend or my family, and diorang cakap kumur guna air garam or mouthwash. So I want to ask, is it effective if we just kumur guna air garam? Thank you, Doctor.
Okay, like I said, macam condition gigi ni is not something. Okay, of course we can ask you like, okay, by pressing down tu how does it feel? Like macam you rasa macam is it actually pain or is it just macam sensitive ngilu or is it like the type of pain macam tu. Tapi however when it comes to gigi condition, we cannot advise until we tengok. So that's why if there is any problem with gigi, memang kita akan advise you to go for medical check-up because dental check-up. So like macam for your case, you kata you makan you rasa macam tu kan. So we need to see either is it sebab gigi berlubang, like it could be kalau gigi berlubang dah kena saraf, there's an infection at the bottom of the gigi, or is it a problem with your gum? Kita kena tengok juga. So I can't really say gargling with air garam tu can be helpful or not. If it is really a problem of gusi, you still memang kena buat scaling dulu, and after that if you want to maintain your oral hygiene and you want to gargle with air garam, then yes, it's okay. But to solve a problem, to solve a dental problem using air garam, I wouldn't advise that lah. I still advise you to come to a dental clinic and we see what is the actual problem, and then you can see how to solve the problem.
Alright, thank you, Doctor.
Okay.
Does that answer your question, Anna?
Yes.
Okay, so I call the next person is Nur Fatin Nabiela.
Hi Doctor.
Cantik lah Fit ni.
So I have question regarding wisdom tooth. I got it recently, both left and right. So dia memang sakit and my doctor advised to remove it, but I'm not that ready yet. So my question is, does it have any effect if I tak remove? And I sometimes selalu lah juga ambil painkiller untuk soothe the pain. Yes, thank you.
Okay, alright. So basically okay, I have to ask you balik, like gigi you ni memang baru tumbuh lah kira ni?
Masa yang sebelah kanan tu dia dah lama tumbuh, and then yang sebelah kiri ni je yang dia dah tumbuh, dia baru tumbuh.
Yang sakit tu dekat yang baru tumbuh ni ke dekat yang dah tumbuh lama?
Dia secara berkala.
Secara berkala, okay. So
berkala.
Bila yes, because actually so your age, I don't know like sometimes bila gigi tu memang betul-betul baru tumbuh kan, memang macam even for a baby, waktu gigi dia nak tumbuh memang akan sakit sikit, betul is gonna come out from the gum. So memang even for a baby pun sometimes they throw tantrums when teeth are coming out. So it's the same for our wisdom tooth lah. So sometimes kita boleh demam, boleh sakit semua when it was coming out. So if this is the first time that you're feeling it, usually kita akan tengok if there's any inflammation or if there's any infection, jahitan kuman ke apa, we would prescribe antibiotics or just painkiller if antibiotic is not needed. And then we review, like let's say we akan tengok, and if let's say kalau after a week or two or after like 6 months lah, after 6 months and the tooth fully came out and lepas tu dah tak sakit dah, we wouldn't advise for cabut. Most of the time it's going to be annoying kan kalau every 2-3 months nak sakit. So that's why usually kita advise untuk cabut je, because cabut tu like, I wouldn't say that painful because kita akan bagi virus, like they will give an injection, akan give so dia akan tak sakit lagi during the cabut. After dia cabut dia might be something, but we also cover the painful lah.
Okay, thank you Doctor.
Alright.
Aku nak tanya,
Okay.
kalau saya punya wisdom tu dia tumbuh sengit tapi dia tak sakit, is it normal kalau dia tak pernah sakit? Tapi saya pernah buat experiment, saya tahu yang dia tumbuh sengit.
Kalau tak sakit memang not an issue, it's quite common actually. Some people memang gigi dia tumbuh sengit, tumbuh tepi, tumbuh masuk dalam semua, but if tak sakit kita tak kacau dia. If tak sakit and it doesn't cause you any discomfort, dia tak ada tergigit pipi, tak ada macam cause any distress to you, then kita biar je, kita tak kacau dia.
I'm from the organizer part, but I have question actually.
Okay.
Okay, so this is like my experience kan. So dulu I jenis yang tak berapa nak jaga gigi. I mean like I do brush my teeth in the morning, but at night it depends on my mood. If I feel like I want to brush my teeth, so then I brush. But if I feel like I want to eat like midnight snack, so I won't brush my teeth at all. So but that one day I have my crush. So my crush actually have a set of beautiful teeth tau. So somehow benda tu macam impress me, and I feel like macam start from this day I want to start taking care of my teeth lah. So I do think that not only oral health that yang improve quality of life actually, Doctor. Crush pun actually improve quality of life.
Oh my god! Wow!
Dah pula.
So I want
Saya pun nak lah.
So I would like to seek for your advice lah kan. So macam after I started to taking care of my teeth because of my crush tu, I like 4 kali sehari kot I brush my teeth. So is this advisable ataupun macam overdo macam tu? Sorry if this
actually
nonsense.
Okay, sebenarnya macam of course like I say it's not necessary. Macam for us usually we would advise to brush only twice a day, which is in the morning and at night. Siapa crush ni I tak nak confess sekarang. Ada
Confess.
Dia tak ada kat sini.
Ada kat dalam ni ke?
Dia tak ada kat sini.
Dia punya crush level lain sikit taste dia.
Dia dah reject pun saja. Tak apa saya.
Alah.
Itu biasa ya. Hidup ini tidak pernah adil ya, Ikin.
Ya,
betul. Saya setuju. Okay, so back to brushing too many times a day kan. Okay, like I said, if you brush with the actual, macam you jangan sental, okay? One problem yang I selalu nampak juga is some patients, gigi diorang start ada macam berlekuk tau. Berlekuk is when they brush too hard. You know, even batu pun, if you keep on hitting the same spot over and over again, then dia akan start ada lekuk. So it's the same thing for our tooth lah. So if you were to brush your teeth 4 times a day, if you use the proper force, you don't use too much force, and then you brush during the times yang I advise tadi, like not immediately after food, like at least half an hour after food, like during a proper time there shouldn't be a problem. But you have to make sure that your brushing technique is proper lah, because let's say if your brushing technique is not proper and you are doing it 4 times a day, it's really gonna like, you know, mencepatkan the process of whatever damage is doing to your teeth.
Does that answer your question?
Yes, I'll try to take care of my teeth better lah, so that I can my crush boleh.
Apa brush twice a day je cukup dah brush.
Madam.
Okay, sure doctor.
So just one more question from Hanani Muhammad Nasir. Are you here?
I want to ask, dulu kalau waktu sekolah dulu, like the dentist akan selalunya pakai tampalan yang warna hitam tu tau. So kind of embarrassing to have the black one kan. So kalau like kita like remove the black one and macam tukar into white one, so apa perbezaan antara white dengan black? Okay, another question is doktor tahu tak yang asah gigi tu, like bila malam like kita akan mulut tu akan bergerak-gerak, like dia macam
waktu you tidur kan?
Waktu tidur tu. Like ada kaitan dengan oral health or something, and how do we stop that? Thank you, doctor.
So the first question tadi is about the tampalan warna hitam dengan the tooth coloured filling kan. Okay, so back in the days, back even during our high school days, because actually dental material, the thing that we use in our mouth, is still a lot of research going on. So every day the products that we use are getting better and better. So back in the days, macam during our school days too, the black filling material memang have superior qualities because it has a good strength, it has a good long term pun dia tahan lama. So basically it's a very good material to use for filling lah. Tapi over time but it has mercury in it, so it's a bit controversial in the dental world. Nowadays macam memang banyak pihak yang fight to stop using dental amalgam, is what we call the black material tu, for good lah. So sekarang memang there's much less use of dental amalgam. And back then, the tooth coloured material, diorang punya properties macam tak bagus sangat. Like it doesn't have a good strength and sometimes it gets discoloured. But over time, the quality has improved. So now, actually kalau nak compare, if you use the good tooth coloured punya product and also the black one, they have similar strength macam tu lah. Yeah, so the black one is actually very good. But it's just that the mercury part is a bit controversial, so more people are choosing to go for the tooth coloured one lah. And if you were to tukar, there wouldn't be a problem lah. It's just that for me, I rasa sayang sebab you know bila gigi you ada lubang kan, we dentists akan drill gigi tu. So kita drill tu, when we drill the back part, we will also take out some of the good part to make sure that the margins are clean. So bila you nak ganti this old filling with the new tooth coloured filling, yes, memang akan nampak lagi cantik. But when we remove the old filling, we will also remove another more parts of good teeth around it juga to make sure that the margins are clean. So more and more part of the good teeth akan be taken out. So macam sayang lah because macam gigi is something yang tak tumbuh dah bila you buang. So we dentists always try to keep as much material as much as the original tooth as possible even bila kita tampal. So bila you buang tampalan lama dan tampalan baru tu, kita akan buang more of the original teeth and it will somehow make the tooth weaker lah. Macam tu. So that is the only concern. Kalau tak, boleh je kalau you nak tukar, but it will make the original tooth lemas.
It's scary lah doktor because I have like black cement tu sekarang tu tampalan tu.
But it's okay, like
I had
good.
that dah lama sangat-sangat lah.
Dari sekolah kan?
Ya, so actually like biar je lah, tak nak lah tukar, biar je lah.
It's okay, you don't have to tukar pun, but macam kalau you tukar, it will cause the tooth to weaken a bit lah. But macam for me, selagi benda tu ada kat situ, lagi gigi tak rasa sakit, tak kacau you, I think it's best to leave it there.
Yang asal gigi tu doktor.
Oh, okay. So basically we call that bruxism. Bruxism tu memang it has no connection to oral hygiene. Dia more to macam psychological juga sikit. And macam biasanya you have that problem kan?
I think so because like I punya sibling selalu cakap macam tu.
So sometimes kalau you ada roommate, your roommate akan sedar malam-malam memang akan bising bunyi Ibrahim nanti. And kalau you should ask your friend, macam sometimes dia akan jadi lagi teruk when you are stressed out. So it's a bit related to your emotions jugalah. Bila you stress, it will happen more often. And there's the way to reduce it. Sometimes you will prescribe muscle relaxant untuk bagi muscle you tak lenguh bila you bangun pagi tu. Because when you have this problem, you bangun pagi gigi you akan sakit. And then you have to go to a dentist. Kita akan bagi you soft splint. Splint tu macam cover gigi you lah. So bila you tidur, you will still have that grinding, tapi dia akan grind dengan this soft material di tinggi di atas dan di bawah. So it wouldn't cause that much damage to your gigi.
Thank you doktor.
Okay.
Thank you to Hanani.
Okay, I have a question. Just to wrap it up. I think today's session we discussed a lot about how to care and maybe some issues with our tooth kan dengan oral care ni. So my question is there any particular study that can probably explain to us how oral care, our level of oral care has to do with our self-esteem, you know, our confidence level? Is there anything like that? And if there are, at what level this is done? And what are some of the maybe empirical evidence that suggest that people with bad oral care doesn't seem to portray a sufficient confidence when dealing with people? Is there anything like that?
As for me, I have never read any papers or researchers on this topic, but based on what I can answer is based on my experience of seeing patients on a daily basis. So what I would say is that it affects more on the self-esteem when it involves the front teeth. Because you know, like people are usually more concerned about how they look like. So usually some patients when they get into an accident and they lose their front teeth, so the first question is really like, when can I get it? When can I get the replacement for this? So it does affect their performance and of course bila tak ada gigi depan, you will be too shy to speak up, and you know, for you to stand out in the crowd to be different from the rest, sometimes you have to tell your opinions and all that. So if you tak ada gigi depan and your self-esteem is low because you're not confident to talk, so it will really hamper your progress in life lah, I must say, because you know, like maybe you have a really good idea that you nak present to your, like let's say I nak present to you like some very great idea about my presentation, but I'm so scared of how I look like. I'm so self-conscious with my gigi depan yang tak ada, so I end up not going to you, and so that great idea in my head stays with me because of my own insecurities and low self-esteem. So yeah, of course it is.
This is not something I created, but when I was undergrad, I was a student. My ustad, he's super nice, but he doesn't have any front tooth. Yeah, dia tidak ada any front tooth, and he doesn't have any front tooth, but he was a very funny guy lah. You know, he was a very funny ustad. We managed to relate to him, but it seems to me like everything that comes out from his mouth was like a real joke. He's whenever he laugh, ataupun whenever he says something, it looks like he's just joking on everything. Like when you don't have a tooth, you tend to portray like a very funny character kind of person. Even when you see animation kan, kalau dia buat animation kartun tu tak ada gigi, that character tend to be very funny. So I find it quite amusing. I'm not sure if the ustad doesn't have any confidence because he seems completely fine throughout the semester. Jadi, maybe we need actually some kind of study to suggest. Otherwise,
that's actually a good idea.
Like you said, there are no studies to indicate this. So I think it's about time that we probably look into it from the sociology or,
like really study on how it affects the productivity of a person or something, right?
Right. So I think it's pretty interesting to see. And I've met people. Dan kalau kita talk about budak kecil, they don't really care about not having the front
Because the
tooth.
thing about budak kecil is that they are all in the same environment where semua orang
Primary tooth diorang.
But like for us adults, when you lose the
So
teeth,
I
you know
guess
that
there are like age
really,
gap where you actually have a very high concern about this. And my ustad at that time, he's probably 60, and he's like, you know what? I don't mind.
It's normal for
It's not like, I'm gonna take on another wife. I'm completely happy with my wife. I don't need anybody to be attracted to me. So I think this could be explained in a more academic perspective.
Thank you, madam. So due to time restriction, I think Alina, you can wrap up.
Can I ask what last question?
Can, but you make it short. Thank you, Akmal.
Regarding on oral health, contoh saya jaga kebersihan tapi kadang ada juga ulcer dalam mulut saya. Itu first question saya. And next question is like berapa kali kita kena buat check up on our gigi?
So about the ulcer, memang there is no specific cause. There is no specific cause on ulcer. So unless you have gigi tajam ke or you tergigit ke, we call that traumatic ulcer where you sendiri yang tercederakan tisu dalam mulut you. So that one, if it's because of a sharp tooth or if it's because you tergigit ke apa ke, then there is a cause for that lah. But there are times where ulcer memang macam they just have maybe genetic, something like that. So and even in the treatment of an ulcer is quite a trial and error. So we have a few ulcer medications, and when you come the first time we ask you to try this one, and if it doesn't work we try that one, because there is no specific causes and treatments for ulcers. It is multifactorial. There's no specific. So it could be your diet, it could be your the condition of your mulut, gigi you selalu tergigit on one side. So,
but I also hear that it could be psychology, kan?
Yes, when you are stressed, when we are stressed out, our immunity comes down. So when your immunity comes down, there's this one type of virus that can cause ulcer also. So this virus akan be active because your immunity goes down. So then you will start getting ulcers. So that is another reason as well. So there are really many reasons for ulcers to happen, but there is no one specific reason that really why it happens. Like even when you baca buku pun, like there's no specific reason, but it can be due to blah 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 blah. So so even in treating them, there is no one specific ubat for it. That you really have to try and error with a few different types of medication and see which one works for you.
And would you advise gargle with garam, like all
gargle with garam? Gargle with garam, it can help with maintaining a good oral hygiene. Like if you already have a good brushing technique and everything, you don't actually need mouthwash. Like you said, macam you guna mouthwash kan to keep your mouth feeling fresh kan? But actually you gargle with normal water pun okay. Even you gargle with saline, which is like air garam tu pun is okay to just maintain good mouth hygiene, cleanliness. And about dental checkup punya kekerapan tu, first you have to come and then you evaluate. If you really memang tak ada problem langsung, once a year is enough. or if you macam ada sikit karang gigi tu, sometimes we ask you to come every 6 months. But it depends on every person to person lah. But usually it's every 6 months or every 1 week.
Thank you, Doktor.
Thank you, Salam Kamal, and thank you, Dr. Alina.
Okay, thank you so much everyone here for being such a participants by tanya soalan yang menunjukkan nampaklah interest masing-masing ada nampak tarik kan nak tanya soalan. Thank you so much. Tapi ada yang soalan yang tak sempat nak jawab. Ada soalan yang tak sempat nak jawab tu, kalau boleh tanya kat channel kita, kat Telegram channel kita. So nanti maybe kita boleh panjangkan kepada doktor and doktor jawab.
Boleh? Yes.
So all in all, it actually back to the basic, right? We need to care of our dietary, our lifestyle, and also I need regularly go for a checkup. At least it depends on different
6 months to 1 year lah.
So because we need to we always hear that preventing is better than cure. So kalau kita tak pergi check up, tak jaga semua kita punya lifestyle, habit semua, nanti the future kita juga nak kena jumpa dentist, nak kena buat treatment itu ini kan. So with no question left, that means this sharing session has near to the end. But wait, we hope everyone can stay a bit more because we want we have actually a little exciting activity with you guys here. But before that, Doctor, is there any advice that you have to share before we wrap up our session?
Yeah, maybe we can hear a few words from you.
Great remarks.
Okay, I think if I ada pesanan pun is because of this current new norm COVID-19 lah. So basically, most dental treatment kita orang guna air yang macam berpercik-percik, bersembuh macam tu. So I would say that dental clinics are actually a very high risk place. So though I do advise you guys to come for a dental checkup just to see your mouth, but I feel like during this COVID season where now the cases are really high in numbers, I would advise that you guys avoid places that are high risk, like especially a dental clinic. I feel like it's very high risk environment. So maybe if you guys were to do scaling but you guys don't really need it, just macam sikit-sikit tu, I would advise that you guys postpone your treatment maybe until after all these things have slowed down a bit, just to reduce the risk on yourself and also the people around you. So yeah, just stay safe, don't go out sangat this New Year, this Christmas season, just try and be safe as much as you can.
Stay safe.
Tak adalah pasal gigi sangat, pasal gigi ada cakap sejam dah, so like yeah, just take care of yourself.
Thank you so much, Doctor.
Alright.
I believe that we have learned so much throughout this session, kan? So, and again, I would like to express my gratitude and appreciation to Dr. Madihah, our guest speaker for today. Everyone, please give a big applause to Dr. Madihah. We would also like to thank our lovely advisor, Madam Azwin Aksan, for today. So, Madam, do you have any last word that you want to say? Remarks.
Okay, I'm gonna try and be very quick. First and foremost, Assalamualaikum semua. First and foremost, thank you to Dr. Madihah for making time. I'm sure it's not easy to get a doctor's time on a Thursday morning. I don't know how many patients out there is crying because Dr. Madihah is with us right now.
Yeah, I already swapped my tugas to someone else.
Right. Because I think I couldn't stress enough about the importance of oral care, because I myself suffer as a child with a lot of oral issues. And I had braces for 4 years. Kita demam, kita pergi, doktor pun tak boleh buat apa-apa. Kalau kita punya temperature tinggi, doktor pun tak boleh buat apa-apa. Kita pergi. Masa kita dah sakit, kita pergi, doktor pun tak boleh buat apa-apa. So it's best to go and see our dentist masa kita tengah free, masa kita tak sakit gigi. That sort of thing. I can advise you, but I'm not doing it myself because I'm still trying to like dentist. Okay, so this is my first step. So I think I will choose Dr. Madihah dululah. The other dentist can give me. So memang I have fear of dentist, but because I have a child, So my daughter, I didn't want her to fear dentist daripada kecil. Jadi saya terpaksa act as a cool mom. Whenever I go to the dentist, walaupun saya tak suka dentist, saya kata, no, it's completely fine. You're going to be fine. So until today, my daughter is much braver than me to go to dentist. So one day she asked me, Mommy, why don't you go and get yourself checked up? Oh, I think I'm okay. Oh. Then said, my daughter tak takut, tapi saya masih takut. So to all participants, thank you for being with us until the end. And to my student host, congratulations for the effort today. Banyak perbezaan, banyak extra creativity yang you buat. And according to Dr. Madihah, you've done your research, betul tak? So ini betul-betul buat research ni. Dr. Madihah pun tak buat research lagi, betul tak doktor?
Yeah, they actually show very good effort lah.
Very good effort, ya.
Yeah.
So memang inilah dia PD Talk series. Apart from fun-fun, tapi kita betul-betul do the research on the topic that we choose. So I'm glad everything worked out. So have a nice day everyone. Alhamdulillah. So far, Alhamdulillah, give everyone a big round of applause. Thank you again, Dr. Madihah. I hope to work with you again in the future, ya. Thank you.
Alright.
Okay, so I'm really excited about today's talk sebenarnya. Thank you guys. Thank you.
Thank you, madam. And I, on behalf of host, I have some few words also. First of all, to Madam Azwin, thank you because you have been so helpful to us. Patient yang penting. And then you are so motherly, madam. Kita orang nak suka kacau, madam. Sorry, madam.
Sedihnya nak nangis.
Because madam, we think like we last night like we all discussed this, madam. We really think you have brought the best of us because all of us right now sebenarnya kita orang dah keluar daripada our comfort zone. Like I have never hosting before. Cady never pegang technical, and then the multimedia team tak pernah edit gambar pun.
Yes.
So you have brought the best of us.
I'm glad to hear this.
Thank you very much.
I hope everyone else yang participant ni pun had enjoy organizing your PD Talk series as much as this group has, So this is something different experience that you could actually experience in a university.
Yes, definitely. And we are actually inducted to you, madam, sebenarnya. So
banyak
sangat lah, madam. Okay.
Saya nak ubat gigi lah.
Okay, and then also to our wonderful guest speaker, Dr. Madihah.
Yes.
We are really grateful sebab thank you to doctor for being so nice, so kind to us, to every one of us kan sebenarnya, sebab doktor daripada awal lagi doktor macam sabar je lah juga dengan kita orang sebenarnya. And then to doctor and all the participants also, actually we no wants to say sorry. Actually, this is like doctor, for your information, this field is not our forte, but we really tried our best. So please forgive us and understand. We lack so much. And also thank you, girls. Girls, where are you, girls? Thank you very much. I wanna cry. You guys have been amazing. So Alina, you may ada tambah lagi tak yang Mayang lupa?
A little bit from me myself, and also my Cady Farashikin Nabiela. Sincerely would like to apologize everyone here for any inconvenience throughout this whole session. Daripada pagi tadi kan semua, ialah biasa segala apa yang terkurang, tersalah tu, salah kata, harap dimaafkan. Last but not least, don't forget to follow Instagram Travel Trover. Doktor, nanti doktor boleh follow Travel Trover punya IG.
Tak follow lagi, semalam sudah buka, tak follow lagi, nanti follow. Ajak
doktor-doktor yang lain follow juga pun boleh. So before we finish this talk session,
everyone, can you please wait? Kita nak photography session, so korang boleh pose.
Okay, kita ambil first photo, okay?
First page.
Okay, 1, 2, 3. Okay, done. Next. Okay, smile, tunjuk gigi, okay? Oh my god. Okay. 1, 2, 3. Okay, freestyle. One, 2, 3. Okay, thank you everyone.
Everyone, jap,
Thank
everyone sekejap We want to make a sequel video. Boleh tak? Okay, so everyone like just do like move macam gerak-gerak kiri kanan dance a bit.
Gerak-gerak simple.
Boleh.
So kita akan record this. Thank you very much. Okay, you can start moving now, everyone.
Buat apa ni?
Just dance.
If you have seen the Blackpink video, you can use the dance.
Ready?
Okay, I would like to spotlight Ikmal Hakimi.
Okay, we'll spotlight Ismail.
I would like to spotlight Ikmal Hakimi today.
Tengok.
Saya tengah laundry.
Okay.
Salah. Iqmal, come on, show us.
Batrisha Azhar pun boleh, madam.
Batrisha. Come on, Batrisha.
Dance. Batrisha.
Oh, tengok.
Thank you very much, guys. Thank you very much, everyone. Semua orang yang sudi luangkan masa untuk join our talk. Thank you very much. Bye-bye.